Browns running back Nick Chubb goes down with an unfortunate and gruesome knee injury. Looks like he had a forced hyperextension with a subsequent dislocation. To dislocate your knee joint in this fashion, you likely tore 3 out of the 4 major ligaments of the knee. First concern for doctors here is going to be the blood vessels and the nerves. Note the popliteal artery running through the back of the knee as well as the tibial nerve. These are important to preserve to avoid limb loss. First, let's start with a brief anatomy review. What we're looking at here is the right knee. This is the outside of the right knee. Now, imagine the ACL kind of like a rope holding both of these bones together. So if it tears, the tibia is going to be allowed to move freely relative to the femur. And this is the basis behind the Lachman test or the anterior drawer sign. You can see how the ACL runs from the front of the tibia or the anterior part of the tibia towards the posterior or the back of the femur. So the shin bone relative to the thigh bone. You'll see that the ACL and the PCL run in opposite directions back here, and they both work together to stabilize the knee and keeping it from coming apart and from rotation. In Chubb's case, the tibia likely gets knocked out. This can cause ischemia to the lower limb, which is a surgical emergency. If you don't restore vascular compromise, you can lose the limb. On the field, the medical team will palpate for distal pulses. They'll reduce the knee back into place, and he'll need an angiogram to assess the vasculature. Another risk here is compartment syndrome. That's when compromised blood flow causes increased collection of fluid in the lower extremity. This can cause dangerous increases in pressure and can also cause ischemia. For Chubb, this is the same knee that he had multi-ligament knee surgery for in the past. This could be a career-threatening combination. Really unfortunate to see on Monday Night Football. Wishing him all the best with recovery.